poszło dobrze. No to
te innowacje w zakresie medycyny
szybko i łatwo zmieniane.
Musi trwać swój czas.
Wdrożenie innowacji nie może być skuteczne bez wsparcia legislacyjnego, a takie jest potrzebne, by jakiekolwiek innowacje w medycynie zaistniały i by skutecznie mogły być użytkowane przez lekarzy oraz przez pacjentów. Ministerstwo Zdrowia powinno w tym zakresie prowadzić wiodącą rolę. Taką tezę postanowiłem zgłębić dziś ze swoim gościem, który akurat wiedzą, co to znaczy wprowadzać innowacje w medycynie, z perspektywy decydenta posiada. Dlaczego? Bo robi to aktywnie od długiego czasu we Francji, w Ministerstwie Zdrowia Francji. Moim gościem dzisiaj jest pani Louisa Stoeve, jest liderką projektu e-zdrowie francuskiej prezydencji w Radzie Unii Europejskiej i pracuje w francuskim Ministerstwie Zdrowia i Prewencji. Jest specjalistką do spraw opieki zdrowotnej i polityki zdrowotnej. Obecnie pracuje jako szef projektu e-zdrowie przy francuskiej prezydencji w Unii Europejskiej. Louisa lubi prowadzić wielostronnicowe projekty i partnerstwa wysokiego szczebla na styku krajowych, międzynarodowych i europejskich korporacji pomiędzy decydentami, sektorem akademickim i innowacyjnymi branżami medycznymi. Teraz przerzucę się na angielski, bo oczywiście rozmowę będziemy prowadzić po angielsku. Now we're gonna switch to English, so good to see you, Louisa. Thank you that you accept our invitation for the podcast.
Thank you so much for your invitation as well.
I know that you have specialized in artificial intelligence in medicine. At the beginning of our conversation, I'd like to ask about the general question. So, as an expert, how do you perceive the broadly understood innovation in the medical sector? And what aspects of the patient-doctor relationship are particularly affected by those innovations?
Thank you for your question. So first of all, I would like to position your question a little bit in the context of the structure I'm working for. So I'm working in the delegation for digital health at the French Ministry of Health and Prevention, as you said. And so our role is to regulate, to provide the doctrine for digital health. And part of the innovations that are being fostered obviously relate to artificial intelligence and health. It's just one part of the big puzzle that needs regulation. And obviously this doesn't only happen at the national level, but also at the European and international level. At the EU level, you might have heard recently about the AI Act or about the European Health Data Space Regulation that we also follow, obviously, with national experts going to Brussels. But in short, what do we do at the national level to tackle these issues? Well, we have developed a doctrine over the past years that we have deployed. So there was a former roadmap for the deployment of digital health, which was between 2019 and 2022, which was put in place a kind of state as a platform model based on very strong values, including interoperability, ethics. And so basically we work together very closely with national but also regional actors to help them deploy digital health at all levels, also on the hospital level. So these actors obviously follow then deploying those solutions, and especially My Health Space, Mon Espace Santé, which is our national health record, to patients, but also support innovation, and which includes R&D and their deployment in hospitals, in academia, and in many different public-private settings. And this we do mainly through the Digital Health Acceleration Strategy, which is a 700 million funded program, also by other ministries next to our Ministry of Health, especially the Ministry of Economy and Finance and the Ministry of Education and Research, which together with us propose this strategy under the control, obviously, of the Prime Minister. So what we're doing now these days to further support innovation in digital health, including AI in health, is to propose a new roadmap, which has been co-constructed with the citizens and with the ecosystem, which for 5 years, so from 2023 to 2028, and which is about to be adopted. So you can also consult the current working documents, but it will be around the 3 core values, which are ethics again, sovereignty, which is very much in line with the European discussions also, that it's in the framework of the European single market, but also as a European Union to be strong and provide European and national solutions in the European Union. And last but not least, sustainability, but we have to think about the economic impact, the ecological and economic impact that our innovations have. So we do this with 2 different ways. So we support co-construction systematically. So we always work together with the innovators, with the patients and citizens, and with the entire ecosystem, the private sector included, to design and deploy our solutions, but also with fast steps. So we don't want to have big ambitions that can never be deployed after all big steps. We take small, fast steps, and we make sure that what we promise is being delivered and always in line with that previous doctrine for innovation. I can elaborate a bit more very quickly on AI for health, what concretely this means by giving you an example of a fast-track access mechanism that has been effective since March 30th. So it's been days that now in France, digital medical devices can access the market in a very rapid way. So basically this kind of reproduces in a different way the German model called DIGA, which is mainly for digital therapeutics. And in France, we do this now also for other classes. So it's more classes than just DTX for digital medical devices. And it means that now as an innovator, you can provide faster access to patients because you get a 1-year trial period and you have to have your CE mark obviously already obtained. And thanks to that, you can provide a suggestion for a price and bring these innovations faster to patients. And after 1 year, the price is being reevaluated, taking into account the data you bring to prove that your innovation works. But this really shows we are adapting to the new trends, including real-world data, new innovations that have very different mechanisms for evaluation than just classical medicinal and evaluations that we already know that is managed by the European Medicines Agency at the European the national level by our national medicines agencies. What is important here is a common topic. It's about data, about health data, because data is what is kind of the food for the algorithms to work to provide the whole meal of innovation in health and including AI in health. And so we strongly support the structuring of health data warehouses, both at the hospital, but also at agency level. We have in France one of the biggest national access points for medical administrative data called the French Health Data Hub, which provides a unique access gateway for public interest research and innovation so that researchers can use that massive data in France, which is mainly insurance data, but we want to make this available. Another project is mainly for citizens, where we want to make data available on current clinical trials, which are being conducted in France, so that all citizens know what is out there in terms of innovation projects and so on that they can potentially be even eligible for. So just in a nutshell, a few projects, a few of our doctrine elements, and hopefully you can dive deeper by reading our documentation.
I must say that you answer many questions that I'd like to ask in just one answer. So I see it as a project that was planned, that has really multiple connections to the sector. It includes doctors, patients, hospitals and other facilities, but also the engineers and companies that produce that innovation that could be used in medicine. But tell me, as a whole process, was it hard to start this process of change, of evaluation in the entire healthcare sector to change it to become innovation friendly? I ask it because we still in Poland don't have such programs, planned program, to implement the innovation in the easy way to be used by the doctors or by the patients. What are the main assumptions when introducing your national program in this area, and what was necessary to get started? Money, goodwill of the rulers, or maybe emphasis on development in this area?
Yeah, you're pointing at some key elements, ingredients already by mentioning the funding aspect, which I think is essential. So we had strong political will with the France 2030 really pluriannual, I think more than 7 billion euros funding provided for making France again a leader also in health innovation, but also more broadly, not only digital health, like a wider national strategy that's available. Part of that is what I mentioned beforehand, the digital health acceleration strategy. So money is a key signal and ingredient to translate doctrine, to translate political ambition into practice, but then you need the tools to make it also happen. And what we do is we, again, work together with the ecosystem. We do lots of consultations on the needs. So basically, we take a bottom-up approach here by really asking the ecosystem what is the kind of calls for projects that they need so that you can construct and tailor them to them. And we have regular calls for projects. We just had the announcement of results for a massive digital health and also health data warehouse call, where at least 5 or 6 hospital groups were being selected. So this is a good example. But again, it goes back to the same ingredients, which are co-construction, consultations, and also small, fast steps. So we need lots of small calls, which are being connected, but we also need to be very agile in order to make also project coordinators stay here in France and also in Europe, obviously, with their innovations to be funded and to be co-funded. I mean, we can't everything, obviously, we're not in paradise either, but we're trying to make concrete, pragmatic steps together with them. I think another important signal that needs to be sent is also the European Union and strong security frameworks and that propose and promote innovation in health. As we do right now, we support the European Commission's proposal for a European health data or input as well with our national experience, but it's important that those signals also come. That being said, we have to not forget the citizen in all of that. It's important to educate, to explain, and also to listen to preoccupations and needs of the citizens, because after all, that's the public that needs the innovation. After all, that's the one, the public is the one that where those innovations are needed. So we need to listen very actively to them and also to the healthcare professionals, because those are the ones also who can save time through those punctual innovations and also be better listeners because they have more time to dedicate to the patients after all. So you see, it's like a little bit the round circle that comes all together if we listen more actively to the ecosystem. So
tell me just the last general question in the first part of our podcast. Tell me, in your opinion, what now is the biggest problem that you need to solve with your program to be implemented and to be accepted by healthcare professionals?
I think what is important is to actually prioritize correctly among all the innovations that are out there nowadays. I think with AI, a totally new scope of the possible has become visible, and we need to see now what do we actually need in regards of our pressing healthcare system needs. So it's important that always our mindset and our state doctrine is to make those solutions accessible, but we cannot fund all of them. Some of them are extremely expensive and can only reach a very small portion of the population. It doesn't mean that they shouldn't be made also accessible, because some patients also can very much benefit from those solutions, but we have to keep in mind always the collective dimension, so that when we choose innovations, we have to keep in mind, are those innovations really at the long run beneficial for a largest possible number of citizens, and can also reduce other costs and burdens in the healthcare system. So it's always kind of this dilemma of choices.
So you look for as you said, so you look for the population solutions and for the cost-effective solutions that can be implemented, let's say, in your whole country.
Yes, and obviously focusing on prevention. So our ministry is now also entitled with a health and prevention focus since last spring with the new elections and so on of the new composition of the government. So this means actually that we need to have a focus on prevention so we can then save money on the care aspect if we prevent better.
Yeah, that's logical. So now I'm gonna switch to Polish for just a moment, and then Katarzyna Kolasa will ask you some more questions, all right? Pani Luiza odpowiedziała na te pytania w części pierwszej, natomiast tą część szczegółową poprowadzi dla Państwa pani profesor Katarzyna Kolasa, profesor Uniwersytetu Leona Koźmińskiego, liderka grupy roboczej NIL Innovation Network Społeczności Lekarzy Innowatorów do spraw sztucznej inteligencji. Zapraszam Państwa do uczestnictwa w drugiej części naszego podcastu.
Okay. Hello, Luisa. Very nice to see you and hear you one more time. Thank you very much for accepting our invitation. Just the final question, just to complete what we already heard from you, which is of a great value for us in Poland to learn from the French experience. And thinking about those best practice sharing examples that you have already kindly mentioned, would you believe is the most important message for us in Poland, one of the largest countries following France and others, in the digital transformation of the healthcare system? You mentioned kindly about the value it brings in terms of the efficiency, but as well as the mindset change. So I wonder, in this environment that we have already a roadmap and directions set up by European Union, what should we do on a local level to make sure that the adaptation of innovation, specifically AI, happens, knowing some potential resistance, both from the clinicians as well as patients? Is it anything in terms of the setting up the local rules that we should focus on to set up the criteria that are adjusted to socio-demographic composition of the country? Have you experienced anything specific that we should make sure that we do incorporate? I know that you have a lot of projects, 700 million euro you mentioned, but nevertheless, it still requires some methodological approach, and being health economics expert, I would be more willing to hear your thoughts around those criteria set up on the local level. Thank you.
Thank you so much. I do believe in the co-construction part. So if your state of Poland would like to launch a strong digital health doctrine, I think you could perhaps start off convincing of the benefits of having a state doctrine. State as a platform model works quite well in France. France is a very centralized state, so I don't know whether this governance model, but I think if you can convince your government to propose a national strategy that you have previously co-constructed with the local actors and with the academia and private sector, this is an ingredient for success for sure. You can already learn from the kind of errors and also the good things, obviously, that your neighbors have done. We have constructed a platform called Genius, where we explain the digital health systems of at least 10, now 11 countries, because Italy just joined last week, where you can see some of the good things and also some of the not so good things that happened in those countries. So I invite you to have a look, and you can also get inspiration from that, what kind of programs you can use to implement. But yeah, I would really advise you go with the co-construction part. It might be a bit long. It might take you maybe a year or so to construct, at least to have a solid doctrine, and do this in collaboration with some neighboring countries. Perhaps you can do a neighboring dynamic, or maybe in collaboration with bilateral collaborations, be it Germany, be it France. Ourselves would be quite welcome to work together on this, obviously in a bilateral dimension. Or you really look into also funding programs of the European Union and all the different, testing facilities, digital decade programs, European Health Data Space fundings to come. I think your government is also involved in My Health at EU and in the secondary use of health data equivalent for the European Health Data Space. So watch out about funding tools which are already available. And I hope you can reach and come to a very successful doctrine for digital health in Poland.
Thank you very much, Luisa.
Thank you as well.
Thank you very much. It's great to hear your suggestions, and we will definitely would like to reach out to you for having more of this kind of collaboration, and hopefully to learn together and to make the process of innovation faster in both of our countries. Thank you very much.